All right, so we are here. Welcome. We have Dr. Hilliard with us. I'm very, very happy to have her on here today, and she's going to be answering some questions. So I'll just start by asking you where you went to school, undergrad and like medical school, and then where you did your residency.
Yeah, so undergrad, I went to UCLA in Los Angeles, and then I went to University of Michigan for medical school. And then I did my residency in Atlanta, and the hospital I was at changed while I was there. So it started out as Georgia Baptist, and then it was Atlanta Medical Center when I finished.
Okay, that's interesting. So you moved from like the West Coast to the Midwest, I guess that is, and then all the way south. Did you feel like one part of the country you had a better time in one region of the country more than other?
There were good things and bad things about all the different places. I'm not a big city person, so Atlanta was nice, but I don't like crowds and cities and stuff like that. So driving around was harder. Michigan was actually a good social environment for me, because I'm kind of a shy person. So the way that, my medical school was, there was a lot of social stuff going on there. So that was kind of a nice environment for me. And LA was the same as Atlanta, just really crowded for me. But there was so much to do there that I really liked that too. So.
Okay, interesting. Okay, because I'm going to school in Spelman right now. So It's Atlanta. I understand that it's crowded. Traffic is bad. It's very different than I'm guessing Michigan is like, but I haven't personally been to Michigan. But okay, that's interesting. And what specialty did you choose?
So I chose OBGYN.
Okay, awesome. And you choose your specialty in the fourth year medical school or the third?
I believe it was the fourth year, yeah.
Fourth year, okay.
It was a difficult decision for me. I think partway through my rotations, I realized that I didn't really like working with death and dying, that aspect of medicine. It was just really depressing for me. And I'm a sensitive person, so I felt like I struggled a lot emotionally when I was going through those rotations where people were really, really sick. And OB was the one rotation that I remember doing that. It was a little bit more upbeat, and it was kind of, nobody was really sick. So, I mean, there are sick patients in general, but OB was a more uplifting kind of a vibe for me. And I like the emergency aspect of it. So I just kind of thrive on excitement. And so, it seemed like everything that was happening so fast, and that kind of excited me a bit. But I also like to work with my hands, and so the surgical part of it was nice. And then I like working with women, and then I also like the variety that you see in it.
Okay, so I have a question. When you hear about doctors, I feel like you always hear that they're constantly on call and that you can't have your personal life really. I guess it's harder for you to manage your own personal life. So you said that you liked the emergency aspect of it. Were you on call? Were you like drawn out of a situation where you're somewhere else and you have to go to the hospital? Or did you feel that you could actually manage your hours better and choose if you were going to be working certain days or not?
Yeah, so it depends on what kind of environment you work in. So I was in private practice through my whole life. And it's more difficult in that setting to be able to carve out your time. And you do get to schedule your own hours, but because you're the only one, it's hard to find time for yourself. And if you partner with other doctors that are in a similar situation, you can get coverage and that kind of thing. But then you start feeling like, oh, these are my personal patients. I want to take care of them myself. And so you sometimes will decide not to do fun things just because you feel responsible for patients.
Right.
If you work for a bigger group, like if for instance, if you work for one of those multi-specialty groups, then there are more people in the group, so you have more free time in a sense, but you have less personal relationships with your patients because it's like whoever's on call takes them.
Okay, all right, that makes sense. I can see that. It's not. Would you say that most of the doctors who are at the hospital, who are there during the delivery and everything, are from their own private practice, or do some of them stay in the hospital, I guess, as like hospitalists?
Yeah, it just depends on the hospital. So, bigger cities tend to have hospitalists that cover the deliveries. But smaller towns like where I am, there weren't any hospitalists. And in fact, we asked the hospital to consider hiring a hospitalist just to give us more free time. And they didn't think that the number of deliveries we were doing at that hospital substantiated it. So that made it So I actually moved away from medicine altogether, and I got a coaching certification in intimacy and relationship coaching, which has always been something I enjoyed, and that was part of the care that I was delivering as a gynecologist. People come in with their marital problems or having issues with intimacy, and I helped them with those things. And that was actually towards the end of my medical career, the part that I enjoyed the most. And when I went and got the certification, I realized how much medicine is lacking in being able to support patients in those issues. And so I felt like that was kind of where I wanted to put my focus. It was hard to do both, and that was really what lit me up.
So you found that people were asking you those questions even as a gynecologist, because that seems like such a clinical aspect of that whole situation, rather than maybe going through a therapist or something like that.
Yeah. One of my colleagues used to joke that we're gynechiatrists, like when people come in, if they feel comfortable with you, which I would always try to put my patients at ease and develop a really strong relationship with them. And once they're comfortable with you, you hear everything. They kind of spill their whole life out in front of you. And, if you're a caring person, you feel, like you want to help them any way you can. And I didn't feel like I had all the tools that I needed to be able to help with that. So that's why I went and got extra learning around that area so I could support them better. For the last year that I was practicing, I actually did them together, and I felt like I was always sort of steering in the direction of doing the coaching instead of, like I'd almost forget to do the regular medical visit. They're like, "Are you going to do my exam?" And I'm like, "Oh, sorry." So I feel like that was really what I was wanting to do more of the time. And even in things like people come in with anxiety because they were in school and they were having anxiety around test taking. And I was like, "Oh, I got some tools I can help you with." And I was practicing my tools. And I was like, I think I really want to be in this realm. But also it would be difficult to recreate a practice again. And I could do it, of course. Medicine is one of those fields that you always have that as a skill. And, if I ever wanted to, I could practice pretty much anywhere. But at the same time, at the beginning, I was getting a lot more joy out of doing the emergency care and the medical side of it and the surgeries and all that stuff. And then after a period of time, I feel like I burn out a bit on that because some of it is kind of repetitive.
Yeah.
I felt like I was thirsty for more knowledge in something else. I didn't want to keep doing the same thing forever. And I feel like I really wanted to go and learn a whole new skill set. And that's what I feel like I'm doing now. So. Private practice is actually becoming less popular because when you first start, you have no patients, so you have no income, so you're finishing school and you have debt sometimes, and then there's zero money coming in. I had a unique situation where the hospital sort of gave me a little bit of support when I first started, and then if I exceeded the amount they were supporting me by, I would have to, pay them back or whatever. But when you first start, you just, you open a office and you have to start paying for rent and all that and employees. And then you go around the community and pass out your cards and make people aware that you're in town. And then, you sit there and wait for the phone to ring. Yeah, luckily I went to a town where they were they needed gynecologists in town. They didn't have one to refer to that they trusted, I guess. Okay. And so it was easier for me in the sense that community just really needed a gynecologist right away. But sometimes people go to towns that are almost saturated with gynecologists, and they struggle to get enough referrals. And the bigger the town, usually the more doctors that are drawn to that town, and then there's kind of saturation in the market, so it's a little difficult to get things going. And people are finding unique, creative ways of doing it. But a lot of people are joining bigger practices or groups like Kaiser and Sutter, those kinds of things too. So.
What was like a typical day like as a just regular gynecologist? What did you see on the daily basis?
Yeah, when I was doing OBGYN, generally, or I would say most days, I had a C-section either that was my patient or somebody else's patient that I was assisting with at 7:30 in the morning. So surgeons like to start early, so we would start at 7:30, which meant that all the patients that I had in the hospital, I had to see them before that. So I would get up pretty early to get there, by maybe 6:45 and see a few patients, do all my notes and charting. Uh-huh. Then I would go into the OR, do a C-section in the morning. And then it felt like it was a race all the time. So it was like I would go grab some breakfast really quick, and I was eating it on the way to the office, and then I would see 10 or 15 patients in the morning, and then go back to the hospital and either check on patients that were in labor or do a surgery. Sometimes I would go to the outpatient surgery center and do short surgery or a major surgery in the main operating room, and then go back to the office in the afternoon and see about 10 to 15 more. And then it depended if I had somebody in labor or not. Sometimes I would go back to the hospital. It would be back and forth to the hospital all day. But then in the evenings, if they hadn't delivered, then it was like every couple hours I was checking on them. And then it just depended, so there was no real structure to the days. Sometimes, hopefully people would deliver before dark, but then sometimes it was 10 o'clock at night or 2 o'clock in the morning or 4 o'clock in the morning. Yeah. My busiest day, I had 5 deliveries in the same day, and I didn't sleep. I was just constantly at the hospital, and I had to cancel patients in the office, and then they're angry at you, and it's kind of a roller stage, just kind of trying to get everything done. But there is some excitement to it, and you feel needed. But then at the same time, it's hard to structure anything. Everything's in pencil, nothing's in pen. So.
Right. That makes me think of 2 things, and the first thing I was thinking of is. Are C-sections that regular where that is something that you see every day?
Vaginal deliveries are definitely much more common. It depends on the risk of the population you're working with. And in my community, the patients were a little bit older and they were a little bit higher risk. There were more twins and those kinds of things. So
okay.
Had a little bit higher average than the national average. But most of the deliveries were still vaginal deliveries, but sometimes they would be scheduled ones because somebody had a previous C-section, or if the baby was turned the wrong direction, or if the person was high risk or something like that, then we would have to deliver them that way, the safest way. I think the biggest thing is how unglamorous it is. People assume, because you're given a certain status in society or whatever, that it's a glamorous profession. But if you think about what we actually do, where we're dealing with people's bodily fluids and and all that kind of stuff. I mean, I've had every kind of bodily substance on my body. and people are a lot of times at their worst. They're under tremendous stress, they're in pain. And so, people are not in their best behavior. So you catch a lot of that, and it makes you a stronger person. You're dealing with people that are screaming obscenities and all sorts of stuff. Yeah. And it's just that the circumstances, have taken them out of their kind normal self. But you see a lot of things. And then you see people at the extremes of, under tremendous stress when they're really sick, or if there's an unexpected bad outcome. You see people and you have to support people through that kind of stuff. So it's emotionally really taxing. And you become better at it. It's harder when you're first starting out than after you have some experience, but it can be really tough. And then especially if there's a bad outcome, which happens, we're human, and then not everything is treatable. And then sometimes people will blame you. And that was the hardest thing for me, is that something that was not under my control that happened. And I tried to do the best I could and did everything that was possible. And then they're like, you did this. It's like, I didn't go into this to hurt people. I'm trying to, I sacrificed a lot of my life to help people. That's a really tough day, and then you get support from your family and everything, and say, and realize that it's really just that they're unhappy that this happened. But it feels terrible to have that finger pointed at you, and you're like, I'm not a horrible person, I promise you. I wasn't trying to hurt anybody. But
Do you think it's easier to compartmentalize as you are doing it for a while?
I think the more experience you have, you know that kind of stuff happens, and you put it in perspective before, and you survived it, so it's like you build evidence that you are enough to go through those kinds of things. But the first times you experience any of that stuff, or even like racist kind of things, when those things happen the first time, you're like, what? Like, I didn't know this was going to happen to me at work, and then after you've had that happen, it's not personal. It's just, it's one of the things that happen. But it can be really tough especially if you're in an environment where there's not a lot of people that look like you, and there's not a lot of support that way. So one of the things I liked about OBGYN is that I think in that field, being a woman trumps race. So I think women are so in or so desiring a female doctor that race is less of an issue in that field. But that's what it felt like. It felt like most women were pretty comfortable having me as their doctor. There are studies that they've done that show that the less you look like Marcus Welby, a white man, especially a seasoned white man, the less patients tend to trust you. So I felt like it was on me to really try to gain trust quickly, try to get rapport quickly. And I had to work a little harder at that, I believe. I shared an office with a white man who he walks in the door, people don't question anything. When I walk in the door, it's like, when's the doctor going to get here? And I'm like, I am the doctor. I don't know how many times I had to say that. Or in the middle of the night, you wake up and your hair is not looking perfect or anything. You go into the emergency room and you're like, I'm going to have to work a little bit to try to gain these people's trust. So it always took a little bit more, or especially when I first started, I looked so young that I would have people going, like, you're the doctor? What are you talking about? And you learn ways to kind of speak a certain way that gains their trust quickly, but I knew that was that was going to be a burden on me to gain people's trust, and I don't know that a white man walking in the room would have the same experience. It wasn't like an everyday thing that I was aware of so much, but new patients, especially, new patient, it was like, okay, is there going to be an issue here? And then you're kind of scanning to see if there's any kind of issue, and what can I do to gain this person's trust? Especially people that are just totally unfamiliar to you, like if you're on call for the emergency room or something like that.
Okay.
I was in Georgia. There were a couple of overt racist things. I got called N-word a couple of times, or girl. People called me girl a lot, which. Sometimes it was like, is this really an issue? Do I need to make an issue of it? But sometimes, it diminishes you though, if you feel like you're not a whole human in their eyes or whatever, and that's hard. And then there's a harshness with both white and Black doctors towards Black residents too. I noticed that you're treated a little bit like you're tougher, or things couldn't bother you. I remember there were a couple of times where even, I was excited that, there were some Black attendings that I would be shadowing. And I noticed that they treated me a little bit tougher than they treated the white residents. And it may just be that they realized that I was going to have to go through more. But at the same time, I already got a whole lot of stress going on. And then you're kind of being tougher on me and didn't feel very I had one lady kick me during surgery. And she was just trying to teach me how to do things, like I was sewing, and she's like, do it this way, but she would kick me every time she told me something. I'm like, you can tell me with your words, and you don't know what to do with that. It's like, I don't even know who I would go to report this, because I don't think anybody cares.
Right.
So those kinds of things would happen, not commonly, but it was enough that you're like, I just got to suck this up, I guess, until I get through, but it was tough.
Yeah, I've never heard that before. No one tells you or talks about that's going on.
Yeah.
I mean, it's just, I think it's just like a testimony that there is still like racism everywhere. And even places where no one is discussing it. That's crazy. I mean, that's.
I think just because I was kind of insecure as a person, I was shy socially, and then I just tend to doubt myself. I'm a perfectionist, so I come from a high achieving family, you bring a 99 home and it's like, what about the one, So and I internalized that myself. And I don't think that my parents were necessarily trying to be too hard on me. They were both valedictorians of their high school. And then I came in 7th, so I felt like I was deficient. And it was my own story that I was telling myself. But somebody told me recently, it's like, excellence is achievable, perfection is not. If somebody told me that when I was young, I probably would have done better with it. But in my mind, it's like, I can never make a mistake, which is hard in a field where it's not, you can't be perfect. I mean, I don't think there is a field you can be perfect, but medicine, one of the hard things is that the stakes are high. And then, there's kind of this idea that you can do it without making a mistake, and you have high achievers trying to do this job. And so there's always that self-doubt, like, anytime, every day you're like, did I miss something? And then if something goes wrong, what did I do wrong? What could I have done better? And everybody could always do something better, but it's always, sitting on your shoulders, just that, even though I know I do an excellent job, could I have done even better? And it kind of produces a little bit of anxiety in you. The one thing I think is good about it though is that you're always striving to do better. Whereas people who walk around arrogant, they may not even be good, but if they have arrogance, they're not going to question whether they did a good job or not. They're just going to be like, yeah, you know, I got this or whatever. So I appreciate it in the sense that I always was looking to make sure, you know, I would go and look facts up instead of assuming that I knew something. Whereas I saw other people practicing where they're like, oh, I've been doing this 20 years. I know what I'm doing. You know, yeah. So I felt like I was on the right side of that. But yeah, there is that. And you build it as you gain more experience, but there is a sort of self-doubt that goes along with being in a high stakes profession. I think probably airline pilots and other people in high stakes professions have the same sort of thing too, you know, but.
Okay. Do you feel like your male counterparts maybe had a lower degree of that, or just didn't feel the that self-doubt as much, that they had more confidence in the rooms that they went in? Because I feel like as women, we diminish like our worth a little bit, or what we're capable of.
I definitely saw that a lot, and with my other female colleagues as well. And the other thing is that there's more pushback from nurses who are mostly female towards female doctors too, and maybe more so with Black female doctors. But when a white man goes in the room and gives an order, the nurses are like, yes, you know. And then when I go in, it's like a conversation rather than an order, you know. And I guess it made me better because I could explain why I was ordering things the way I was, or, you know, why that was my decision. But it felt like there was a little bit of, you know, I was giving a suggestion, whereas they were giving an order, you know. So, but there were times where I had to be a little bit more, you know, stern with something, because either they would just disregard what I said, or, oh yeah, I'll get to that in a minute. I'm going to do Dr. So-and-so's thing first, even though my thing was more urgent. You know, there's sometimes, you know, I have to fight for the patients and just be like, this is more urgent, needs to be done now. And it takes me out of my own personality, just because, you know, I don't want to have to fight with you to, you know, to get what I need for my patient. And that was ultimately what the thing was about, was I wanted my patient to get good care. But it felt like I had to exert more force to get that done, because there was a little bit of pushback from the nurses, or, you know, I was kind of seen as a girlfriend, and the white male doctor was seen as an authority figure. And so, which was nice in a sense that I got included in certain conversations. So it depends on what you think of as challenging. So for me, the emotional stuff was always the most challenging. And one of the hardest things for me was taking care of really young people with complicated issues. You know, it felt unfair. It's like, how does this 19-year-old have all these medical issues, or, you know, have cancer or something like that? And that always felt really tough for me. But it taught me a lot, because sometimes people with the worst challenges, they've, you know, just broken open so much that they have such wisdom in them sometimes, even, you know, despite their age. When I was in medical school was kind of during the hard times of, I mean, not that HIV is a great disease to have now, but it was during the really hard times of AIDS, where we didn't have good drugs, and, you know, it was just, we were just starting to get information about it. But I had a really young patient that had it, and, you know, he was really sick, and just talking to him, I would go in there just to sit and talk with him all day. And it just taught me so much about humanity, and you know, everything was kind of stripped away from him, but just to see, you know, his soul, like, you know, those kinds of moments were really powerful for me. When I did my oncology rotation, we did 8 months of oncology, which was hard for me because I felt really depressed the whole time. But I had one nun who had advanced stage cancer, and every time I'd walk in the room, she'd be like, "How are you doing?" And I was like, "Oh, what? Are you serious?" Like, I would just get chills. She's like, "Sit down, honey. Take a
nice.
sit down." And we would talk, and I would almost like cry, because I was like, how does anybody care about me when they're in this state, you know? But she, you know, you could just see the humanity there. So it was good and bad, you know, like it was hard to watch somebody suffer like that, but then some of the most beautiful stuff comes through in those moments. Or having to comfort somebody if they lost a loved one or something like that was really tough. Some of the tougher things, just, you know, knowledge-wise or medical-wise, were if you're in the middle of a surgery and then you go beyond your skill level, if you will. I mean, not that you haven't been trained, but you just get into a really difficult surgery and you're like, I don't know what to do at this point. But that's where that humility comes in handy, that you don't keep going. You find somebody who potentially knows more than you. You know, you'll find a specialist, and sometimes you have to wait. But to just humble yourself and be like, the outcome here is more important than my pride. And sometimes it's even that you don't know what you're doing, you just get doubtful, and so you'd rather have another pair of eyes there, and somebody who's more experienced or somebody who has a different skill level than you, and so you'll call them and they're like, you know what you're doing, go ahead and do what you thought you were going to do, but just you needed some support. And so those are the times that it's not easy to call somebody and be like, I don't know what I'm doing.
Doctors don't have all the answers, and I guess
but I learned early, just be on the safe side and call if you don't need help rather than don't call when you do need help. Yeah. If you get in there and there's like a lot of scar tissue where everything's stuck together, sometimes you get in there and everything, you can't even distinguish one organ from another, and you're like, I don't know what I'm looking at, and I don't want to go poke holes in the bowel or the bladder or something. So many times we'll call an oncology surgeon because they're used to dealing where you can't see distinct planes between things. And they just have really good eyes when it comes to that kind of stuff. And they have tricks of how to find where you are. If you're like looking for a blood vessel, they have little tips and tricks on how to find it, even if you can't see the usual anatomy and stuff like that. So I would call them a lot of times and be like, thank you so much.
So what is the best piece of advice that you've gotten in your career thus far?
It's hard to think of one, but I'll give you a couple of them. One is one of my mentors told me when I was finishing residency that if you treat every patient as though they were your sister, mother, or daughter, you'll never go wrong. Mm-hmm. And so just reminding myself, and I felt like I always would do that this is somebody's family member. This is not just patient X in room 110 or whatever. This is a person's family member, and they could be my family member, so taking care of them in that way, you just won't make the same mistakes you would if you just say the generic woman in room, whatever. The other one is that self-care is not selfish. And I think a lot of people who are high achievers tend to put themselves last on a list. Yeah. And just the idea that if your cup is empty, you have nothing to give. You have to put self-care first and replenish yourself first. We're taught that selfish is a bad word. It really isn't. And women especially are taught that you're supposed to give to everybody else, but not give to yourself. And really, you can give more to other people if you're full. So I would recommend it.
I feel like that's something that we've been hearing more about lately. I don't remember hearing that so much when I was younger, but I feel like over the last 5-10 years, people have been talking more openly about mental health and having self-care days and whatever that is. So I feel like that's appropriate timing. We still have a lot more work to do in that though, because I definitely know for myself, I'm like, oh, go, go, go. And if I'm not going, then I like the quote that you said earlier about to strive for excellence, not perfection. Personally, that's something I need to be, telling myself a little bit more of. So I really appreciate that. Talking about the mental health, how has COVID-19 affected you or maybe like your colleagues?
For me, I had gotten enough tools for myself when I did my coaching certification, just on really good self-care practices, that I felt like I was in a really good place to handle the stress of it. So every morning I would get up and meditate, even if I only had 5 minutes to do so. And I had been in the practice of doing that. A lot of people have a hard time quieting their mind during meditation, but I had been doing it for a while. And so I felt like I was, getting some good meditation in there. And that helped me regulate my stress a lot. And then part of it also was that I had started transitioning into coaching. So I had decided for myself that, like, if I don't survive, I can't take care of anybody else. And so I was not in any rush to get out. And, I was waiting for more information to come in. And I know it was a hard time to sit still and just wait for the information, but I felt like I had done enough internal work to be able to sit there and just kind of wait. And I'm like, 3 weeks is not a big deal until we get more information or whatever. But a lot of people were so frantic and trying to, oh, this doesn't make any sense, and and they were trying to get back to work faster than was safe to do so. And so I saw some of my colleagues struggling with that. And there's sometimes a martyrdom in medicine where it's like, we have to take care of people. And there are safer ways to do that, like over telecommunication. And sometimes those things were not in place, but you can quickly get those things in place. It takes an afternoon to figure out how to use Zoom. So I counseled a couple of people I knew just on trying to do those kinds of things rather than thinking you have to lay hands on all the time for things that don't require that. And so you can still care for some patients without having to, physically put yourself where the patient's at risk. But I heard that a lot, that, we have to do that. We have to go in there. And I didn't feel the rush to get back to work.
Yeah,
right away.
Yeah, that's good. So you're telecommuting right now?
So I'm just doing the coaching now, and it's all online. So
Right.
That's the beauty of it. I don't have to see people physically.
Oh,
or I
sure.
can be safe. Yeah. I find that the depth is actually as good, if not better, online. I feel like, I don't know if it's that people are in their own environment, so they feel a little bit more comfortable, but I feel like people are able to be comfortable and share more online than they are in person or something. I don't know. I think there's been a lot of focus on work-life balance for physicians. So I know, like in residency programs, they limit the number of hours they can work continuously, which I wish had happened right before I went to residency.
Yeah.
We work sometimes 30-hour shifts, and I don't think anybody should ever have to do that kind of thing. So I think there is some focus on, doing things in a safer way in that sense, but also more physicians coming out of residency are employed rather than self-employed. And so they're joining bigger groups where they can have bigger call groups and have more time off. And then I've even seen some physicians who do job sharing and that kind of thing, which is nice, that, you can kind of design your career in a way that you can still have a life. So I think that's great. And then just all the technology that's coming in is making things easier, with automated tools that help, checklists and things like that make sure that you can care for patients better, which takes some of the bias out. I was reading some stuff about the implicit bias with racism. And if you have automated tools that just ask the same questions to everybody and offer the same things to everybody, then it takes the decision maker out of the equation. And so there's less room for bias. And there are some problems with the tools too, because there are some biases built into them. Computerized systems will look at the amount of healthcare dollars spent on a person to decide how complicated their illness is. And if you're offered less expensive treatments, then you end up looking less complicated, and you could be just as complicated or more so. But the algorithms that take into account the amount of money that's been spent on you during the year don't realize that because of bias, less money's been spent on you, even though you may be more complicated. So then you're not offered other programs and stuff like that. So just looking at the tools with a really critical eye to make sure that they actually are fair.
The last question I have for you, a little bit different. I'm a big book reader, and I wanted to know if there are any books that you really like that are medical related, or just like any other books.
Yeah. The one that I read recently that I loved was by Resmaa Menakem, and it's called My Grandmother's Hands. And it talks about racial trauma and how to unwind trauma. And it's both written for people of color and non-people of color, just, being aware, how to become aware of your biases, even internalized racism of people of color, ways that might have affected you because you're in a culture that, where there is white supremacy, you adopt some of that too, and how to correct it and how to unwind the trauma in your body. And, things like breathing practices and movement practices that help to get the trauma out of your body. And I've been doing some of those things, and it's been really useful, just to illuminate some of the stuff that I wasn't, completely aware of, that I adopted, just being in a world where, you're always kind of scanning for danger. And it didn't feel that way. It's not like I would have said I grew up in a dangerous community, but when you're not like anybody else, and you're wondering if this person's racism and that one's racist. You're always, you know, or teachers, you're like kind of always preparing yourself or going overboard to try to win people's affection. So you do this song and dance of, you know, either being a clown, you know, like, you know, let me try to be funny or whatever, just so that I'm accepted that way, or just giving people a path when they do, you know, microaggressions and stuff like that. So just being aware in your own system, like the reason why I did this is to try to stay safe in an environment where I didn't feel like I was, but, you know, how do I unwind that from my body and not shame myself for having done that too? That was important.
That's really good.
Yeah, it's a good book. It really is. Yeah.
Oh, yeah, I'm going to add that to my TBR. Thank you so much, Dr. Renee Hilliard, for being on our series with us. We're so glad that you came here to talk to us, and I learned a lot of stuff. So it's been a pleasure.
Thank you so much for having me. I love this.